want to be a nurse and you don't like blood, can you still be one? My opinion is yes. You do not have to work on a hospital floor to be a nurse. You don't have to work at the hospital at all. Your whole career does not have to be in the hospital. You don't have to work with blood. You may have to talk about blood or know some procedures, stuff like that, as a worker, but you will not have to work with blood. Don't think that all nurses work at a hospital, because they do not. Nurses work at their house. They work within the community. The downside is that, some neighbors and some friends and family might come to you all bloody. So that may be a thing, because once you're a nurse or even a nursing student, people like my family, they come up to me and ask me these questions, and I'm just like, I know nothing. And it's my friends' family is coming up to me asking me questions, and I'm just like, I'm not a nurse, so ask me in like a year when I graduate. It's a thing. It's a thing. It is a thing. It is a thing. It is a thing. I don't know how many times I can say it is a thing in one video, but it is a thing. People will come up to you and ask you all these, these questions about, like, I don't know, hemorrhages and blood pressure and all these medications and blah 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 blah. And yes, I knew the answers to the questions, but if you don't want to deal with blood, and you live, say, in like a suburban area, and you're like the only nurse that lives in that area, people are going to come up to you. They're going to have gardening accidents, like the snipper thingy, the shears. They're going to have shear accidents, or they're going to have lawnmower blade accidents, and they're going to come up to you. So that may be a thing. I don't know if that's deterrent for you. I don't know if you live on like a farm and you're all by yourself. Not all by yourself, but like a couple miles away is your next door neighbor. But just think about that. Not all nursing is in the hospital. Not all nursing has to do with blood. But because you are a nurse, people expect you to be okay with blood. So they may come up to you and ask you these questions. And they may come up with like a finger that's kind of just like hanging, and they're just like, help. And I'm just like, go to a doctor? Go to the emergency room. Do you want to lose your finger? What were you thinking? But just be aware of that. That is a thing. It may not be in your area, but it is for me personally. You can work with blood. Sorry. You can work as a nurse without blood. So don't think that it's some like foreign, alien-like thing, because it is not. You can work as a nurse without blood. Okay? Bye. Don't forget to like and subscribe.